Very good evening, ladies and gentlemen. Thank you very much for tuning in. I'm Sneha Koshy, and you're watching Beyond the Headline. Giving birth to a child is one of the most beautiful processes. Some would say magical. The planning, the pain, the anxiety, the birthing, it's never the same for any woman and for the couple, if they are willing to be partners in this. But any pregnant woman or the parents-to-be are more often than not fraught with several questions. Will this be a natural birth or a caesarean? Will the labor be hugely painful or a breeze? Do I need so many scans? And this gets even harder when you hear about instances of doctors pushing for caesareans or mothers-to-be demanding caesareans. Karnataka government has decided to act. They've said some of the private hospitals have up to 80% of deliveries as caesareans. And that, according to them, is unacceptable. But what's the India picture? Let me break these down for you with the facts that we have been able to piece together. As the income goes higher, the rate of C-sex increases. In fact, the wealthiest people in India report twice the number of C-section deliveries on an average. Or simply put, among the rich or the affluent, there's only an increase in C-sections. In fact, southern states report much higher C-sections than their northern counterparts. All southern states. And the bulk of them are in private hospitals. Remember, in Karnataka, the minister has said that C-sections have increased from 35% to 46% in 3 years. Higher institutionalized birth, lower income inequalities are some factors that do set the southern part of India apart. But is there more to this? Can a mother-to-be trust her doctor, whose advice in such crucial phases, many would argue, must also trump the family's preferences? Tonight, we are looking at the business of birthing. But amid all this, can a state interfere in choices of a mother or parents-to-be? Where does one draw the line? Before I introduce my panelists, I'm being joined by Karnataka Health Minister Dinesh Gundu. Thank you very much, Minister, for joining us. Good evening to you. My first question, what's the sudden focus on the form of delivering a baby, the process of delivering baby, C-sex or natural birthing? How does this really come about?
So, the reason why we want to focus on this is we all know that giving a birth to a child through a natural process is far, far better for the health of the mother and the health of the baby. And we are seeing an increase in C-sections that are taking place in Karnataka. For the last 3 years, if we see the curve, it's gone up by more than 15%. So this is something which is very worrying. And we don't want people to be unnecessarily being made to take C-sections, caesarean operations. And we want to promote the natural birth. So this is a cause of concern for us, and that's why we're going to come out with a policy next month on how we can promote natural birth of babies, and also we need to disincentivize the exploitation of doing caesarean operations.
Well, exploitation of doing caesarean operations, that's a very huge term. It's a huge allegation, as you're putting it. So are you suggesting a nexus behind increasing C-sex in India, or to be specific, Karnataka, since that's your state?
No, I won't say a nexus, but what is happening is in private hospitals, they feel that giving a C-section delivery is also something which they can earn more money. Second thing, it's also very, quite convenient for them to do. Giving birth to a natural process, there is more effort in terms of preparing the mother and trying to prepare her psychologically, physically, mentally for that. So doing a caesarean operation is just like just cutting open your stomach and taking the baby out. So it's less taxing for the doctors and the staff and more remunerative. And so that is one of the reasons. Second thing is nobody is really making an effort to promote natural deliveries amongst amongst pregnant women.
Mr. Dinesh Gundu, you almost possibly put it very simplistically, if I may say, but how staggering are the numbers?
See, the policy still has to be, it has to come to paper. It's going to take another few weeks that we're working on. But broadly speaking, we see some of the private hospitals where they are doing C-sections at the rate of almost 80%, 85%. That is unacceptable. If they're doing C-sections at the rate of 40%, 45%, even 50%, I will accept that to some extent. But if a private hospital is doing C-sections at the rate of 80%, 75%, that is not a normal number. So there is obviously something else going on there. One. Second thing is hospitals also should incentivize the doctors when they do normal deliveries. Private hospitals, I think there should be a method where when they do normal deliveries, also there should be an expenditure, a payment made. Like how a C-section delivery, there's a payment made to the hospital for delivering a C-section.
So, to people who ask, what's the state's business to decide on how a couple or a mother should give birth? What right does the state have? What would you say?
I think definitely it's a state business because exploitation of certain procedures, because it is more remunerative and easy at the cost of something which is actually doable, is something that the state has to look into. And see, we are looking at two aspects. One is in our own government hospitals. Though the numbers are lesser than the private hospital, there are more natural childbirths in a government hospital than in a private hospital. So, but we are looking into our own system, how we can improve our own functioning, but also at the same time make the private hospitals aware that you should also think along these lines. The gynecologists, the pediatricians, the obstetricians, they should think along these lines of promoting natural live birth. And like I said earlier, if an hospital is doing 80% C-sections, then that is something then the hospital is purely functioning without really getting into the health aspects of the mother to be. So health is an issue where I think government can definitely always play a role.
Minister, thank you very much for your time. A very complex issue, but very important questions also being raised here. Thank you very much for your time. Let me at this point also introduce my panelists. Dr. Malvika Sabrawal, senior gynecologist, joins us. Good evening. Dr. Shikha Sharma, a senior nutritionist as well, is part of the discussion tonight. Good evening. Professor Bejon Kumar Misra, who's a consumer policy expert. Thank you very much, sir. Good evening. Thank you for joining. I'm also being joined at this point by Satya Prakash, who's a spokesperson for Congress, as well as Dr. Lakshmi Ashwin Gowda, spokesperson for BJP. Thank you very much, both of you, for joining us. Good evening. And I'm also going to be joined shortly at this point by Brinda Dige. But very quickly, Dr. Malvika, if I can come to you first. Look at the numbers. The Health Minister of Karnataka saying that 80%, some hospitals, some private hospitals have seen at least 80% of the deliveries being cesareans or C-sections. This is huge, and he's saying it's absolutely unacceptable. Now, how do you explain this?
Thank you so much for inviting me for this forum. It's very interesting and very important for us. I belong to Jeevanmala Hospital, which is a private hospital and has been there for 104 years. And I would definitely want to be part of this because this is very close to our hearts. You know, cesarean or a normal delivery. Delivery is a very beautiful process for a young mother. In fact, the mother and the father, for both of them. Today, we see a lot of fathers also getting involved in the pregnancy process. They come regularly with their wives to the hospital. In fact, we encourage them to join the birthing classes because they form a very important pillar to a pregnant girl. And they help the mother to relax as she's delivering. And she's part, in fact, we encourage them to be in the labor suite with the patient. That's number one. So we definitely encourage them to have a normal delivery. Secondly, what our minister from Karnataka said, that there is a lot of difference in the private sector wherein the charges are there, which have to be like literally a monetary aspect to the whole thing. It's not like that. I joined practice in the year 1981. And this was almost like 85 or 86. We are in New Delhi. Safdarjung Hospital was having a meeting wherein they had called a lot of people from government hospitals and private hospitals. And my one very important suggestion was that when a patient delivers privately, let the cesarean rate and the normal delivery rate be the same. If they are at par, nobody can say anything. Number one. Number two, a lot of work goes into conducting a normal delivery, wherein cesarean, as he also pointed out, is a more simpler procedure procedurally. You know, you just go and do the cesarean and come out. But at the same time, to do a normal delivery may take much longer. You have to be very vigilant for the mother, for the baby, and both lives are with you. So therefore, I think it's very important monetarily for them to be at the same, the cost should be the same. Which was, I think, even followed in a few hospitals. Even in our hospital, we try and keep it at the same. So nobody can tell you, okay, you're charging more for the cesarean. Number one, the next most important part is, when we do a cesarean section, it's very clear. Either we are doing for the mother, to save the mother, if she has an issue, if she has some problem, if she is having a growth retarded baby, or if she's going into a blood pressure which is not controlled, or so many other medical factors, or if there's a fetal distress or a fetal problem. And today we see a lot of people, young girls, do not get married on time. They get married much later. They want to be settled in their work. And when they get married, they don't want to plan a baby very early. They are much older as compared to earlier. And when we are talking of the relations and the incidences, we are talking of all the reports, the surveys which were done by NFHS in maybe the third or the fourth or the fifth. So if you're comparing that time when the girls were getting married earlier, they were having babies earlier, now they're landing up having IVF. The babies are more precious. They don't want to take any chance, and they know the ovarian function goes down after the age of 30 years. They may have eggs which are not so up to date, and they may be having fallouts like abortions, etc. Then of course they have to take more care for a pregnancy which has gone through all that rigmarole of your NT-NB scan which we do at 11 weeks. Everything has been ruled out. The baby is normal and they've reached the stage of viability, and that is the time when they want absolutely a good childbirth. And they cannot, mentally that stress level is so high. They would much rather have a cesarean. Mind you, this is one of the reasons. Second reason, a lot of people want a Mahurat baby. What can you do about the Mahurat baby?
I'll get back to you.
I'll get back to you,
Dr. Malvika. Let me just get in Brinda Adige at this point. Let me just get in Brinda Adige. Brinda Adige, you heard Dr. Malvika speak. We also had the Karnataka minister earlier talk about how there seems to be an 80% increase in cesareans in, say, it is some private hospitals, but there's a huge jump across private hospitals in the state. We've seen how this seems to be a pattern across India. Do you accept what Dr. Malvika is saying, or is there another concern that you have?
I do not want to accept, because we know that almost all private hospitals recommend and suggest C-section to women, telling them that the natural childbirth is very, very painful, but do not give them the complete awareness and education of the lifelong stress and lifelong physical ailment and pain, back pain, that women would get as a result of C-section. And we know that, because once you have the C-section, women are advised not to carry any heavy things, not to do this, not to do that. And age, I don't think that is so much of a factor, especially because today most women are very health conscious, which means they are exercising. And like the doctor pointed out, if they are being treated along with the spouses or the partners to go through various exercises at different weeks and stages of pregnancy. That should not be a problem. As far as the cases that we have come across, and many of the cases, that anecdotal cases that we have been told, it's always been money. And it begins with what is the kind of insurance that you have. So if you look at the face sheet or the case sheet that people take at the beginning when the pregnant woman goes in, after your primary information, it is the kind of insurance, health insurance that you have. Based on that health insurance, it will be that C-section and whichever ward it is. So the C-section might be similar in the same ward, in the same labor room, but the fact that you stay in your insurance a little higher, you get put into another room and it's very, very high. So we know for sure that babies are precious,
But that's a
and
choice
all
you can
women
make
want
as a
their
couple
babies
or
to be
as a
safe.
mother. Miss Adige, but that's a choice. Which room you want to take? How do you want this to go about? That's really a choice every mother or every couple can make.
Absolutely. But also it is recommended based on your insurance. So the price of C-section
Okay,
varies.
so you're
Not
essentially
so
saying
much
the
the
insurance
rooms
is
that they
at
might
play.
stay in. That is the personal choice that they might
Okay,
want to
Professor
make.
Bejon, Kumar, Misra, how do you look at this? I mean, you have Miss Adige saying that, listen, there's this whole insurance play, there is this whole money play, the income bracket, and that's also kind of, at least from the studies that have come about, there seems to be a direct correlation in terms of the cesareans that have been performed in the private hospitals for the rich when you compare it to the other income groups. How do you explain this from the experiences of consumers reaching out to you?
Understand first that health is a state subject, and Karnataka government has taken the right decision to get into this nexus which is been existing in India for many years now, and it's growing, it's becoming epidemic. So what we have to understand is the Karnataka government, based on evidences which they should investigate, should come out with a robust policy, if not a regulation. And I just heard one of the medical practitioners saying that certain hospitals disincentivize. They have equal cost involving natural birth and C-section. Now, something like that has to come into India also. And Karnataka can give the leadership. In my view, we have to stop immediately these kind of enrichment which is going on in the health sector. And as we all know, even the Honorable Supreme Court has intervened.
No, but Mr.
To
Bejon, I just want
that
to understand something. Why do you call this a nexus? On what basis do you call this a nexus?
because they are not giving proper evidences to the authorities in terms of why they had to go for C-section. There has to be proper evidences created where there is a kind of a life-saving intervention made to save the mother or the child. So that evidence has to come out very clearly, and there has to be a third-party audit to ensure that such interventions which are made by some of these hospitals where the percentage is so high, that why is it going so high in those hospitals and why not in the remote locations of rural area hospitals where childbirth is happening in normal time. And I clearly remember that even my child, when my child was born, the way the doctor cajoled my wife to ensure that she gives a natural birth and not go for C-section, even though she was in terrible pain for more than 24 hours. The bottom line is that we cannot compromise on the health and safety of the mother and child. That is the first thing.
Okay.
But the most important issue
Health
is
and safety
we have to
of the
make
mother
sure.
and the child. Dr. Shikha Sharma, if I can get you in very quickly to respond to Professor Bejon Kumar Mishra. I mean, we had Dr. Malvika a while back speak about how the age of women becoming pregnant has been pushed quite a bit. They're choosing to get pregnant much later after they have a career, about, what they call in medical terms the precious babies or the, high-risk pregnancies, to put in a very different word. All of these come into the picture. But all of these cases can also have normal deliveries. They do not always have to have what we say, say a cesarean. So where does one draw the line? How does one decide?
See, I'll tell you, I would say I've heard both all the panelists. I think each panelist's point is very, very valid, but in a certain perspective. Like Dr. Malvika, what she's saying is very correct. If somebody has had IVF and they are having a twin baby, it's, I think, really hard for them to have a normal delivery because twin babies are not easy to deliver normally. That's one. Second thing is if it is a primary first time the lady is having a baby and she's already crossed 40, then what happens that it is a lot of pressure on the mother and the doctor to ensure that there is no risk, because most of these ladies are already hypertensive and they have high blood pressure due to the pregnancy. So what we are trying to say is that yes, there is also a social impact which is not being measured here, which is late pregnancies, high risk pregnancies, IVF pregnancies, and all of that. And if you look at the lifestyle, I mean, if you see that 20 years back or 30 years back, the hypertension rate was in older individuals after 55. Now the hypertension is coming at 30, 35. So it's not always that one side of the story is wrong. There has been a change, societal change in the health status of people. And that is why I think a lot of that also needs to be measured. I would say data should be published that how many of these were young mothers and how many of them were mothers who had precious pregnancies. Of course, the easiest way to handle this would be to have the same cost for delivery, whether it is a cesarean or a normal delivery, because at least the cash incentive completely goes out of the window. Then it's only about case to case basis. So I would say that yes, Karnataka government by raising this issue has done a great thing.
Okay, very quickly before I go to Dr. Lakshmi as well as Satya Prakash, Dr. Malvika, very quickly, I want to spend a minute with you. Dr. Malvika, here's the question, and that's a very important point that's coming in. Whatever we discussed right now are the high-risk cases. But if you're looking at the kind of jump in cesareans across the country, is that really indicating only the high-risk cases? And that's a big question that we have to ask.
Not really, because that is one section of the cases. But remember, when you're comparing the data, yeah, can you hear me? Can you hear me?
Yes, please, go ahead.
Hello? Okay, so when you are talking
Malvika,
of these cases, they're not just high-risk cases. Today, there is a demand for... So there is a demand for cesarean sections, whether it's a Mahurat baby or otherwise. There's a lot of demand. Now, the girls today are very scared of delivering normally. They cannot even, squat. Ask them to sit down. My dadi, my nani used to sit down on the floor, sit on the patri and do so many things. A simple thing like, I would tell my patients, aap patri pe baith ke matar chilo. You understand? You open up the peas, aap matar ke dane nikalo. Niche baitho. Now we teach them exercises to do squatting, etc. Because today it's not only the high risk, but the other girls who are not fit to deliver normally, they have to do exercises, like I mentioned earlier. They are mentally not there. They are absolutely in the favor because their friends have delivered just with the one, you give a spinal anesthesia, you do a cesarean, you're done and sorted. And they want an easy way out. They do not want to take the labor pains. And let me tell you one thing. The first thing what Shikha has also pointed out and which another doctor also mentioned, that the cost should be, and I mentioned for the first, initially only I said, as early as 85, I said the rate of the cesarean and normal delivery should be kept same. So that thing is absolutely out of the window. You don't even talk about the monetary aspect at all. It is
but you would agree that's far from a reality. That's far from a reality for any state in India across the country.
No, it is not.
That's far from a reality, Dr. Malvika.
I cannot. You please, let me tell you. Okay,
there may be some hospitals and some gynacs, but at least largely that's not how you see the numbers across the state, Dr. Malvika.
Okay, but then we should definitely increase the, I would say, the maternal the family literacy, wherein they understand what a normal delivery is and they should be encouraged. They should be, all these pregnant girls, I as a person, it should be mandate for them to go through these classes. The literacy rate has to go up for these patients and they should understand how a normal delivery happens. And that is a doctor's domain to do it. Another thing what Shikha pointed out, that
let me just shift our focus. Allow me, Dr. Malvika, to just shift our focus.
It should be an ongoing study.
If I can get in Mr. Satya Prakash as well as Dr. Lakshmi Ashwin Gowda in. Satya Prakash, do you agree with what the Karnataka government has said? I mean, it is your government. But in the sense of what many would question that, listen, the state doesn't have a business to peep in. The state cannot regulate this.
See, Sneha, we need to understand that today the business of C-section has become a menace. Today, as our Dr. Sabarwal and even Mr. Misra was telling, that why do we do a C-section? We do a C-section if there is any threat to the mother or the child. And this includes, there is a procedure involved. There is involved of, giving, taking the patient to the operation theatre. There is a procedure, surgical procedure involved. Why should we put the mother and the child under undue risk of a procedure where they will give, sedative things, when you are doing the procedure? So what Mr. Gundu, our health minister, has said is, we will do an audit. How can all the hospitals, especially the private hospitals, have 85 to 90% and most of them being Caesarean? It is impossible. When the government hospitals are doing it at 25 or 30%, how can the private hospitals have 80 to 85%? Here, any child born under normal delivery, he will have better health in the coming future. Today's children are going to be nation's future. Keeping this in mind, the Karnataka government has said we will do an audit and look at the national average. The national average of C-section
Mr. Satya Prakash, if that is really a science that can be established, that children born through natural deliveries will be more healthier than those that are born through C-sections. I don't think that is based on science. I leave for doctors to claim on that. But let me get in Dr. Lakshmi Ashwin Gowda. Dr. Lakshmi Ashwin Gowda, Satya Prakash is saying, listen, this is an absolute business. This is a racket, this is a nexus, and the state has a jolly good business to crack this down. Do you agree?
I definitely agree with Mr. Satya Prakash. I'm so happy that at least now the Congress dispensation is coming out with one initiative, positive initiative to curb the number of cesarean section, which is rampant not only in the state of Karnataka, but in the entire India. It is the saddest state of affairs that most of the times the child and health care hospitals, the multi-speciality hospitals, and series of hospitals like birthing hospital, premier birthing kind of concept they have, they would actually prompt the patient, they would actually intimidate the patient, woman and also the husband to go for a cesarean section. I myself is the real example. I myself the doctor and I had to undergo cesarean section. And in the last moment, I was actually terrorized. I was told that I could not actually go for the normal delivery because of various issues. Though my health, all the parameters were normal, and this would be the case with other women also. They would intimate the same thing, and they will impose their own thing because and the fee structure. And the fee structure between the normal delivery and the cesarean delivery is hardly a difference between the fee structure is hardly between 5 to 10,000. When I underwent the cesarean section, the fees was 1,10,000 for cesarean and 1 lakh for the normal delivery. So we obviously, I didn't prefer, but they actually made me to go for a cesarean. But most of the women, they prefer to go for the cesarean section. First of all, to bear less pain. And this is the myth. They'll not bear any less pain with cesarean section. They'll have to go through hell kind of pain for the first 2 to 3 days, at least for the 6 days postnatal period, postpartum period. They'll have to undergo tremendous kind of pain. In that scenario, what will they do? They'll inject lots of painkillers, lots of antibiotics, and once again, it is not at all.
So, is this that rare case where the opposing political parties are seeing eye to eye? They really are on the same page.
Yes, correct. because this is one social initiative. It is they are taking care of the health of women and the child. That is the utmost utmost requirement of the society. Because if you go to any hospitals, I don't want to name anyone where I underwent
Sneha,
cesarean
That's
section.
true.
The percentage of cesarean delivery is 61 to 62%. On each and every day, on an average, they'll do at least 3 to 4
Okay,
cesarean
before I go to
deliveries.
the doctor, Satya Prakash, you
And
want to
one
make
more
a
thing
point.
I'd like
Satya
to tell
Prakash,
you. One more thing I'd like to tell
a
you.
rare support coming in politically.
Sneha, we need to understand that forget childbirth for the time being. If it was any other operation, if you were supposed to go to an operation or I was supposed to go to a surgical procedure, we will think twice, thrice before we go into the operation theater. There is a huge amount of risk involved in a surgical procedure. There is a chance that, either there will be a problem for the mother or the child. Now, what this law will do, if at all, whenever we bring the policy changes, we will do an audit and the doctor has to have some proofs as to why he went and did a cesarean operation. If it is going to be a monetary consideration, that is where our health minister have said we have to bring laws in place that this sort of abuse of the process should not be allowed. How can you expect 80 to 90% of all the cases that go into the private hospitals to get into the operation theater? How can it be? Let us take the biggest hospitals like, the big specialty government hospitals. Are there 80 to 90% cesarean operations being made? No. And most of these doctors in these private hospitals get their PG done in AIIMS and big government hospitals. How is it that those hospitals are having a cesarean only to 30 to 35%? And how is it these private hospitals are having 80 to 90%? This is where the nexus comes. This is where the pressure on, I don't blame the doctors. I blame the management. They are being pressurized to have more billing. When there is pressure on them for more billing, these sort of things will happen.
Dr.
That is where
Malvika?
every government should proactively act so that in the interest of the mother and the child, a legislation should be brought where there is an audit that has been done, where the right
Malvika,
procedures have been
important
undertaken by
questions, and you
the,
also
by the
had
doctors
Dr. Lakshmi
to
a
make
while
sure
back
that it is a
speak. Satya
cesarean
Prakash
or a
is
normal
speaking the
delivery.
same thing. Big concerns here. How does really one know when a pregnant woman is reaching the hospital and has to make that decision? Often the decision is not the woman's, because how can a woman go around debating, discussing, arguing with the doctor? If the doctor says you are unfit to deliver naturally. So where and how does one go about this?
No, I'm actually not clear about what you said, what you wanted me to answer. But one thing what Mr. Satya Prakash and Dr. Lakshmi was saying earlier, I see the first thing is monetarily one should just level it out, number one. Number two, audit is a must. Sorry, Sneha, I may not be answering your question, but I will definitely hear the question again and answer it definitely. But these things have irked me also.
No,
that,
so Dr.
of
Malika,
course,
here's the question.
I may be doing my work, but we have to do the auditing to know
a
say
pregnant
twice.
woman reaches the hospital and goes to the doctor and says, listen, I have to give birth. They go through that whole process. It's often not for the mother to decide whether she is going to deliver naturally or the cesarean way. It's really the doctor's call. How often can you have women go up and say, I'm not going to follow what the doctor says, I want to go to the natural way, I want to go to the cesarean way? So here's the question. How do you trust a doctor?
How do you trust the doctor?
Trust a doctor.
Is that the word you used? Trust?
That's right.
I can't hear.
That's right.
How do you trust? No, you see, the patient who comes to the doctor, see, in today's world, one must understand the patient has to have trust in the doctor, and the doctor, it's the doctor's duty to make sure that the patient is rightly trusting in the doctor, and give her the best. It is the patient's decision, definitely, and the doctor has to help her to deliver normally. And for that, we have to, at least make them literally, at least understand what the process is, whether it's a normal delivery or a cesarean. And everything, I hope you can hear me because I cannot hear you. Sneha, are you there?
No, no, I
can't hear
can
you.
very clearly, loud and clear.
But any which ways, okay. So the patient has to have trust and understand what the doctor is trying to tell the patient about the natural process of birth. And
All right.
that is
Okay.
the way the trust begins.
Okay.
All through the 9 months, the patient
Brinda
comes
Adige,
to the
a
doctor
very important
and
question, and
they
this is where I
develop.
want you to come in. As a person who's worked in this sector as an activist, who's been with women, who've gone through the process, who've been part of different researchers, Brinda Adige, would you see what the Karnataka government has announced as a watershed moment? Or would you say there is concerns of excess here as well? While there are excesses allegedly in the Caesarean world, this could be a stepping stone to another form of excess. Where do you see yourself on this?
I do not think that the step of the Karnataka government is in excess. This is something that should have come way back, but we are seeing it now, and I think it is the right time. It is important that there are these checks and balances brought. Ethically, there was no need. If there were these issues of ethics that we are talking of with hospitals, managements, and doctors, there was no need for any such kind of a law. But today we know that it goes beyond. It goes beyond a single doctor or single anesthesia or nurse's decision. It is the management's decision, and such a law is very required. So I would agree that yes, this is a watershed moment, and it is something that must be under the aegis, and the government has a responsibility towards the health of its citizens, especially children and women.
Professor Bejon Kumar Misra, I know you are not the doctor, but you're also somebody who's been very closely associated
delivery
with consumers as well.
covered by the
What
TPS?
would you tell are the red flags?
You see, the most important aspect is, as everyone has covered, the trust and relationship is built on, constant counseling with the patients, and also to ensure that there is a transparency and accountability which comes into the process. And what we find in India today, because I run a foundation called Patient Safety and Access Initiative of India Foundation. Now, in that foundation, our work is primarily to ensure quality healthcare is made accessible to all. To all, I mean. So I don't want to see that a normal delivery gets cross-subsidized and the normal delivery cost goes up just because we want to cross-subsidize C-section. No, that can't happen. We have to ensure that normal delivery has to be incentivized and has to be fully subsidized as much as possible to encourage mothers to go for normal delivery, and also the doctors to ensure that they don't get targeted by the private healthcare providers by giving them targets to raise revenue for the hospital through C-section. So we have to become transparent, accountable, bring laws and processes in place which will ensure improvement in accessibility for normal delivery, and also ensure accessibility to cesarean where it is absolutely important and necessary.
Okay.
So there is an element of trust which has to be built based on transparency and accountability, which I think the Karnataka government is trying to do. I personally know the intent of the Honorable Minister, and I can only appreciate at this present moment till he doesn't implement it in an efficient and effective manner.
Okay, Dr. Shikha, if I can get you in at this point. I mean, why is this divide? One, of course, we discussed about the private hospitals, about the rich and the richer. But let's also look at the north and the south. Southern states have a far more incidence of cesarean birthing. Why?
We must look at, we would require more data, like are these overlapping with obesity? Because there are some certain states where obesity is very high, like Tamil Nadu and, some of those places. So we have to see that are these high incidents also overlapping with some other diseases, whether it is obesity, whether it is infertility, whether it's some other conditions. Because what I feel is that we have to look at data in a holistic manner. Once we look at it in a holistic manner, then whatever solutions are implemented, they will be more effective. So that is my one thought off the cuff. Other conditions could also be seen that does that in terms of private hospitals, are these private hospitals all corporate hospitals, or are they doctor-run hospitals? Because those things also start mattering after a point of time. So I think if more data is collected in terms of patient comorbidities, patient age, in terms of the financial position of the corporate hospitals, so then the decision would be more holistic and more it'll be more deployable. Otherwise, what happens sometimes, knee-jerk reactions, the policies come in, but then after 5 years, much has not changed on the ground.
All right. I think there's a lot more to discuss on this. The Karnataka government's order is yet to come out. We don't know what the policy is going to be. Nonetheless, as many of you have pointed out, Satya Prakash, I think you want to make a statement. Please go ahead. Yours would be the ending statement.
One quick statement. You see, there is a
so two important things,
correlation between the per capita
normally
income in southern states.
my experience suggests, one second. My experience suggests that C-sections happen more because of two things. One is that muhurt one, which they said. In case of that, the doctor should go for counseling the patient. That muhurtam se kuch nahi hone wala. The health of the mother and children is very important. That is on one side. Lot of counseling to the mother and the family of the mother. Point number one. Second thing is there is a nexus with this cashless insurance companies being there of overbilling. And when can you do overbilling? You can do overbilling only when the customer, the mother gets into the operation theatre. So if you stop mother getting into the operation theatre, Caesarean is not necessary. And this insurance nexus between the insurance companies and the health hospitals, this nexus should be brought down. Counseling should be given to mothers in cases of all these blind faiths. There should not be any space for that in today's science.
Okay.
If we do that, second problem is once you do a Caesarean C-section, the second delivery also should be a C-section. After doing one C-section, the second delivery cannot be normal delivery. So
now, I will have to get in a doctor. Dr. Malvika, is that true? What I've heard, that's not true.
No, that's not
You
right.
can
That's
also
not
have
right.
a natural birth
That is
after
not
a
right.
cesarean.
That is not right. Sir, that is wrong. Of course, I've had series of cases wherein all the six, and it is something which is a, lot of patients, not only in government, in private, everywhere they're delivering after one cesarean, they have a normal delivery. There's nothing like that. I think just because Karnataka did come out with this statement of 68.7% having cesareans, now suddenly there is, like Shikha said, they could just be a knee-jerk reaction.
Let us find out.
And
how many? Let us find out, doctor.
There are states.
How many?
No, one second. Audit is something. Listen,
I think I'm totally out of time.
Audit should be there.
Sneha,
Audit should be there as an ongoing.
word.
And you must realize, no, Sneha, one thing I want to say one thing. Listen, we have to, compare apples to apples, not apples to oranges. You're talking of 20 years back and today. 20 years back, all girls were getting married at 20 years of age. And now they're not getting married even at 30. So these are not good to be compared. You have to have an ongoing audit all the time, whether it's government or private. And you must remember the government,
all right.
the patients
Yeah,
who
one
come
quick-
to government
Totally out of
hospitals,
time.
what strata they are
Professor
from.
Bejon, very
and
quickly.
Also,
Yes.
Sneha, my quick response is that southern states look to be higher only because they are the highest in terms of per capita income in the country. So we have to understand that the economic profile also is pushing mothers to go for C-section because they can afford it and they have all got insurance covers, which is highest density in the southern states in the country. So that is again one of the areas which has to get investigated in terms of, as I used in my earlier opening remark, the nexus.
All right. Okay. This is a complex issue. Karnataka is taking a
deliveries.
very, very
No, Sneha, we
crucial
do not
step.
have. I want
think
to make a
everybody will be
statement.
watching out for it. There's always a lot of talk about cesarean versus natural birth. We don't want to get into medically what one must go to and what somebody must opt out of. That's the doctor's domain. But it's important to bring out and open what often are whispers in corridors, and that's whether there is a nexus at all. And that's where I think Karnataka is moving towards. It's important also to see the data in the larger picture. Dr. Lakshmi Ashwin Gowda, Satya Prakash, Dr. Malvika Sabarwal, Dr. Shikha Sharma, Professor Bejon, Kumar, Misra, Brinda Adige, thank you very much for joining us. And we just hope that we've only equipped parents to be and young mothers to be to have a more beautiful and more enriching process. Thank you very much. Time for a very short break. On the other side, news and updates.